My name is Nadine. I'm a respiratory therapist, and today I wanted to go over module number 1 with you on what is pulmonary fibrosis. And so in this module, basically we'll cover what the different kinds of pulmonary fibrosis are, what exactly it means and what is happening in the lungs, what it can be caused by, and how it's diagnosed and what the symptoms are of it. So some basic things. And then we will go into further depth in other modules. So, firstly, what is pulmonary fibrosis? So it's a chronic disease, meaning it's with you for the rest of your life once you're diagnosed with it. There's no cure. The lungs basically become scarred and stiff, and that's what fibrosis means. So if we look at the pictures here, it's a little bit easier to explain it to you. The top picture is a set of normal lungs, a healthy set. And so what happens with this is the oxygen comes through the trachea or the windpipe, and then it branches off into all these small little tubes, these branches. And then once it gets to the end of those tubes, we see these structures here, which are blown up. And these are called alveoli. They kind of look like little grapes. And so once the oxygen gets to those areas, it has to be exchanged through the tissue into the bloodstream so that the oxygen then can be transported throughout the body to all the organs. So in a normal set of lungs, we can see how thin the walls of these alveoli are. And so this makes it easy for gas exchange to happen because it just has to travel across a small barrier. Okay. Now looking at a pair of lungs that have fibrosis, we see that again, the oxygen will come through the same tubes, but these alveoli at the end, as you can notice, their walls are much thicker. And so that poses a problem for the oxygen to actually get across into the bloodstream and get around to the body. So when the alveoli are thick like that, oxygen has a hard time passing through, as well as they become stiff. Basically, they don't move. They're not as malleable as they should be. And so when we have a stiff lungs, basically they can't fill up quite as much as we'd like them to, which leads to lower lung volumes and lower lung capacity. So over time, basically, we see a drop in oxygen levels, and the thickened tissue basically causes the stiffening, so they can't stretch as much. A healthy set of lungs has a lot of give to it, and they're able to expand and then also depress down quite easily like a balloon. So eventually, basically, we don't have enough oxygen to go throughout the body. And this is especially noticeable when you start to exercise or, even small exertional activities can cause the shortness of breath. So if we look at this picture, this is another good way to kind of describe it. So the top picture is a nice wet sponge, and that represents a healthy set of lungs that can absorb lots of oxygen or lots of water in the sponge's case, and it's also very malleable, and it's some healthy tissue. And then as the sponge dries, this kind of represents a scarred or a stiff lung because it has very little flexibility, and it doesn't stretch and open and close as nicely as the wet one. So that's kind of a good picture to keep in your mind. Um, so how common is pulmonary fibrosis? It's pretty rare. It's found throughout the world, but in Canada, about 5,000 to 15,000 people have it, but it affects people of all races everywhere. The causes of pulmonary fibrosis can be divided into two different categories: the known causes and the unknown causes. Unfortunately, most of the causes of it are unknown, and this is what we refer to as idiopathic pulmonary fibrosis. So idiopathic basically means we don't know what caused it. So majority of those cases are idiopathic. Between 14 and 15,000 Canadians are idiopathic. Another little tidbit of information is actually males are more common to have it, and also over the age of 50. Then there's a category that we definitely know that there's causes, known causes of the pulmonary fibrosis. So certain environmental exposures, so either occupations or, environments that we live in or are around a lot. So repetitive exposure to certain things can cause the fibrosis. A lot of times it's organic substances like molds or animal proteins, bacterias, things like that. So that's one big category that could potentially cause it. And then the other huge category is potentially medications. So different types of medications that could cause include inflammatory meds, cancer treatments, so chemo or radiation, antibiotics, cardiac medications, stomach medications, or certain inhaled drugs or chemicals. Okay. Another big one, or a big link that we've seen, is people with connective tissue diseases. So rheumatologic or autoimmune conditions such as rheumatoid arthritis or scleroderma have been linked to pulmonary fibrosis. Signs and symptoms of pulmonary fibrosis. So, of course, like we've mentioned before, the shortness of breath, especially when you're exercising or when you are exerting yourself, when your heart has to pump a little bit harder, that's when you will notice it. Another big one is a dry cough. So, no phlegm, but it's very, very hacky cough. Almost starts with a tickle in your throat, but it's relentless cough that just doesn't resolve. Okay. Other things are fatigue, loss of your appetite or unintended weight loss. We can also see rounding and the enlargement of the fingernails. So this picture down here shows the clubbing. This is what we call clubbing of the fingernails, and that's actually a sign of lack of oxygen. Okay. And that's usually seen in the advanced diseases. Sometimes we'll see pedal edema or swelling fluid in your ankles or your feet. And then if we listen to the lungs with the stethoscope, we can often hear what we call crackles. And this actually basically sounds like somebody pulling apart two pieces of Velcro. And that's actually the lungs opening and closing and having that hard time because they're so stiff. Some risk factors that have been identified for idiopulmonary fibrosis include genetics, your age, like I said, middle-aged, so 50 and above usually, gender, so again, more common in males. If you have acid reflux, definitely a possibility of causing some issues with the lungs. If you're a smoker, if you've got radiation exposure, and then, like I said, again, certain occupations that are going to be exposing you to repetitive um, substances. So farming, construction, mining, things like that. So how do we diagnose pulmonary fibrosis? So first off, we basically start with a complete history and a thorough exam, and then we do some diagnostic tests. If you have been suspected or diagnosed with PF, then often you're referred to a respirologist who is a lung specialist. Then once you have been diagnosed, and the respirologist will then kind of try to figure out what specific type of PF you have, if possible. Sometimes we don't know, and that ends up landing in the idiopathic category, like we mentioned before. So some diagnostic tests that we do. So chest X-ray, definitely. CT scans a big one. It helps us identify potentially the type and how bad or how much of the lung is affected. So if we look out to the right there, we see that picture of the normal set of lungs, and on the right side is the fibrosis lung, and you can see it almost looks like little honeycombing at the very bottom of it here. And so we refer to honeycombing is basically those damaged alveoli, and that's kind of what they look like on the scan. So in this lung, it's at the base of this lung on the outside, we'll see. Often we'll do pulmonary function testing, and that will also tell us how advanced, what your lung capacities are and how much they've dropped. Oftentimes we'll do repetitive tests so that we can kind of see the progression if it's gotten worse. And then there's also a specific test that can test to see how much of the oxygen is actually able to get through those tissues, and that gives us another really good value to watch. Oftentimes you can get blood tests to help identify the type of PF. Sometimes you'll get a walk test, a 6-minute walk test, and that's basically to see how much your oxygen, if it is dropping, how much it drops with exertion. And then lastly, we can do lung biopsies or bronchoscopies. So that would be a camera going down into the lungs, either taking some tissue samples or fluid samples and sending them off for testing. And so in this other picture here, we can see again a lung biopsy, and you can also still see that honeycombing structure in this biopsy compared to this normal one. So that's basically the nuts and bolts of what pulmonary fibrosis is. In the following modules, we'll cover more detail about treatment and how to deal with pulmonary fibrosis once you've been diagnosed. Thank you for listening.